If you've recently noticed swollen ankles, tighter shoes at the end of the day, or deep sock marks on your skin, I want you to pay very close attention because today you're going to understand something that could completely change the way you see this problem. Many adults over 60 live worried, believing that swelling automatically means a serious heart or kidney condition. And yes, sometimes it can. But in many cases, the real cause is something entirely different, and it can be improved. I'm Dr. Gabriel Mena, and over the years I've seen countless men and women come into my office feeling anxious because of heavy legs, swollen feet, and constant pressure around their ankles. Many of them had already gone through blood tests, cardiac exams, electrocardiograms, and medical evaluations. And when everything appeared normal, they went home confused, thinking they would simply have to live that way forever. I especially remember Marta, a 72-year-old patient who once told me something I never forgot. "Doctor, by the end of the day my legs feel like they're filled with water." Her heart tests were fine. Her kidneys were working normally. Yet every evening her ankles looked almost twice their usual size. What we eventually discovered was that the real issue wasn't her heart at all. It was a body system that very few people talk about, one that naturally slows down with age, the lymphatic system. And that's exactly what we're going to talk about today. I'm going to explain in a simple and practical way what lymph is, why it can cause swelling after 60, and what daily habits may help improve the natural drainage of your legs from home in just a few minutes a day. Stay with me until the end because understanding this may help you not only reduce swelling and heaviness, but also walk more comfortably, rest better, and feel lighter throughout the day. There's something important I learned after more than 2 decades caring for patients. Modern medicine works extremely well during emergencies, crises, and acute illnesses. But when someone experiences ongoing symptoms that reduce quality of life without being immediately dangerous, those symptoms are often minimized. And this happens all the time with swollen ankles and legs in older adults. People are told, "It's just aging. Walk more. Elevate your legs. Drink more water." And while those suggestions can sometimes help, very few people take the time to explain what's actually happening inside the body. When someone comes into a clinic with swollen ankles, doctors usually follow clear medical protocols. They check the heart, blood pressure, kidney function, and circulation. And that's important because serious conditions must always be ruled out first. But here's a detail that's rarely explained. There's a huge difference between an organ being diseased and a system simply working more slowly. And that's where the lymphatic system comes in. Imagine for a moment that inside your body there are 2 major transportation networks. The first one is the circulatory system, which most people know well. The heart pumps blood, blood carries oxygen and nutrients, and then returns back to the heart. But there's another network that's less famous and absolutely essential. It works like an internal cleaning and drainage system, collecting excess fluid, cellular waste, and substances the body needs to remove. That system is the lymphatic system. And here's the most important difference. The lymphatic system does not have a powerful pump like the heart. It depends almost entirely on body movement to keep fluids flowing. Every time you walk, flex your legs, climb stairs, or contract your calf muscles, you help push lymph upward. It's very similar to gently squeezing a tube to move what's inside. Now understand this carefully, because this is where the real issue begins. As the years go by, many people become less physically active. Not because they want to. Sometimes it's knee pain, fear of falling, fatigue, reduced strength, or simply more sedentary habits. And when the body moves less, lymphatic drainage slows down. The lymph begins to stagnate. And when that happens, fluid starts accumulating mostly in the lowest parts of the body, ankles, feet, and legs. That's when swelling, heaviness, and that uncomfortable tight feeling in the skin often appear by the end of the day. And I want you to hear this clearly. This does not mean you should give up. The lymphatic system responds surprisingly well to simple and consistent stimulation. Before we continue, tell me in the comments where you're watching from and how old you are. I truly enjoy reading your messages because this channel was created for real people who want to better understand their health and feel supported along the way. And if you know someone dealing with swollen legs or ankles, share this video with them because it could help more than you imagine. Now, There are several reasons why the lymphatic system tends to work less efficiently after 60. The first is the natural loss of elasticity. Just like the skin and arteries age, lymphatic vessels also become less flexible and efficient over time. The second factor is reduced daily movement. Many people believe they're still active, but compared to earlier decades, they spend far more hours sitting. More television, fewer walks, fewer stairs, and less overall movement. The third factor is insufficient hydration, and this surprises many of my patients. As we age, the sensation of thirst decreases. Many people drink less water simply because they don't feel thirsty. But when the body becomes dehydrated, lymph fluid thickens and circulates less effectively. In other words, drinking too little water can actually worsen fluid retention. And there's another major factor: heat. During hot weather, blood vessels expand more easily, allowing more fluid to leak into surrounding tissues. If the lymphatic system is already sluggish, that buildup becomes even worse. That's why so many people notice more swelling during summer months or after standing for long periods. Now I need to pause for something extremely important, because there are situations that require immediate medical attention and should never be ignored. If swelling appears suddenly, especially in only one leg, you should seek medical care quickly, because it could indicate a serious vascular problem. If swelling is accompanied by shortness of breath, chest pain, palpitations, or difficulty breathing, medical evaluation is urgent. You should also seek care if the skin becomes red, hot, or associated with fever, since infection may be present. And if elevating your legs does not improve the swelling at all after a reasonable amount of time, it also deserves professional evaluation. But when swelling affects both legs, worsens toward the end of the day, improves partially with rest, and heart and kidney tests are normal, many times we are dealing with something very common after 60, lymphatic stagnation. In simple terms, it means that fluid that should be circulating and draining efficiently is remaining trapped longer than it should. And the good news is that this can often improve significantly once you understand how to properly support your body. Never underestimate simplicity. In medicine, the most effective tools are not always the most expensive or complicated ones. What truly matters is giving the body the right stimulus consistently. This method combines three essential elements that help the lymphatic system function more effectively: positioning, movement, and conscious breathing. When these three work together, the impact on lymphatic circulation can be remarkably powerful. I call it the morning lymphatic activation routine. And the best part is that you can do it before even getting out of bed. No machines, no special equipment, and no exhausting exercises required. Think of those first few minutes in the morning as an opportunity to wake up your body's natural drainage system. The first step is very simple: elevate your legs. Before sitting up, place 1 or 2 pillows underneath your calves and ankles so your legs are slightly above heart level. Why does this help? Because gravity starts working in your favor. After hours of sitting or standing, fluid naturally tends to pool in the lower legs. Elevating them helps that fluid begin moving back toward areas where the body can process it more efficiently. You don't need dramatic elevation. A comfortable and gentle position is enough. Stay there for about a minute while breathing calmly. It may sound too simple, but I've seen people experience relief just from adding this small habit. I remember Ricardo, a 68-year-old patient who spent decades driving buses. He sat for long hours every day and told me his legs felt as heavy as concrete by nighttime. After starting this morning routine along with a few simple lifestyle adjustments, he told me something interesting. "Doctor, my legs feel lighter earlier in the day, and I'm less exhausted at night." After elevation comes the second step: activating the calf muscle pump. And this is where something fascinating happens. Your leg muscles act like a natural pump for both lymph and venous blood. Every time they contract, they help push fluid upward. With your legs still elevated, slowly flex your feet forward and backward. Pull your toes toward you, then gently point them away. Move slowly and comfortably without strain. This movement specifically activates the calf muscles, one of the most important areas for circulation and lymphatic return. Many physical therapists consider this one of the simplest and most effective exercises for improving circulation in sedentary people or those prone to swelling. Continue for about a minute. Then add slow ankle circles in both directions. This helps mobilize smaller structures around the ankle and prevents fluid from remaining stagnant for long periods. And now we arrive at something many people never expect to matter so much: breathing. Yes, proper breathing also affects the lymphatic system. When you take deep abdominal breaths, the diaphragm moves up and down like an internal pump that helps move lymphatic fluid. That's why many people notice relief when they combine gentle movement with slow, controlled breathing. While continuing the foot movements, inhale slowly through your nose and allow your abdomen to expand. Hold briefly, then exhale gently through your mouth. The goal isn't perfection. The goal is calmness. Besides helping lymphatic drainage, this breathing pattern also reduces tension, anxiety, and nervous system overactivation. And that matters more than most people realize, because chronic stress can worsen inflammation and encourage the body to retain even more fluid. After 1 or 2 minutes of movement and breathing, you can move on to the next step: upward massage. Sit slowly at the edge of the bed and use both hands to gently glide upward from the feet, from the toes to the ankles, from the ankles to the calves, and from the calves to the knees. Always upward. This matters because lymphatic vessels are designed to move fluid in that direction. The goal is to support the body's natural flow, not work against it. There's no need for deep pressure. In fact, too much force can become uncomfortable and unnecessary. The lymphatic system sits very close to the surface of the skin, so gentle massage is usually enough. Think of it as a slow, smooth, relaxing movement. The entire routine only takes a few minutes. But I want to be very clear about something. The key is not doing it once. The real difference appears when the body receives repeated stimulation every day. That's how adaptation and recovery work inside the body. This is not about chasing overnight miracles. It's about consistently helping your body function better. And when this routine is combined with certain daily habits, the results often become even more noticeable. The first of those habits is hydration. I know many older adults drink less water because they feel less thirsty or worry about waking up during the night. But poor hydration can make lymphatic fluid thicker and even harder to move. That's why I often recommend starting the morning with a glass of water before coffee or breakfast, unless your doctor has specifically restricted fluids. Another essential habit is avoiding long periods of sitting without movement. The human body was not designed to stay motionless for hours. Even walking briefly around the house, moving your legs, or standing regularly can help much more than most people realize. Every small movement reactivates that natural pumping mechanism that supports fluid return. It's also important to be careful with excessive heat. Many people notice that swelling becomes dramatically worse during hot weather. And there's a reason for that. Heat causes blood vessels to dilate, making it easier for fluid to accumulate in tissues. So if you struggle with swollen ankles, try to avoid intense heat directly on your legs for prolonged periods. And there's another topic people rarely discuss enough: excess sodium. Highly processed foods, deli meats, canned products, and heavily salted meals can significantly increase fluid retention in many people. This doesn't mean eliminating salt entirely, but it does mean becoming more aware of hidden sodium in everyday foods. Sometimes small dietary adjustments create surprisingly large improvements. Another useful habit is sleeping with a slight elevation under your feet. You don't need a dramatic incline. A small pillow or gentle elevation can help your body drain some of the fluid accumulated during the day while you sleep. And now I want to speak to you not only as a doctor, but also as a human being. I've seen many older adults live in fear when their bodies begin to change. A swollen ankle can turn into nights filled with worry and negative thoughts. I'm losing my health. I'm going to become dependent. Something serious must be wrong. And when nobody explains what's happening, the mind naturally imagines the worst. That's why I believe understanding your body is also a way of recovering peace of mind. When you understand what may be happening and learn what actions are still within your control, you stop feeling completely helpless. And that emotional shift has a tremendous impact on health. Because people who understand their bodies usually care for themselves better, move more confidently, breathe with less fear, and participate more actively in their own well-being. That completely changes the relationship with aging. This is not about fighting your body. It's about learning how to support it. Now let's talk about compression socks. Yes, they can help. In many cases, they're useful and serve an important purpose. They provide external support for the veins and lymphatic vessels, helping prevent fluid from accumulating so easily in the lower legs. But here's something important. Simply wearing them isn't enough. I've seen many frustrated people say, "Doctor, I tried compression socks and they didn't help." And once we reviewed how they were using them, the problem became clear. The most common mistake is putting them on after the ankles are already swollen. At that point, much of the fluid is already trapped in the tissues. That's why compression socks generally work best when put on early in the morning before swelling develops. That detail alone can completely change the results. Another important factor is the compression level. Not all compression socks are the same. Some are mild, some moderate, and others much stronger and intended only for medical supervision. Because while they may seem harmless, excessive compression can sometimes be inappropriate for people with certain arterial or circulatory conditions. That's why I always recommend caution and common sense. And there's another mistake few people talk about. Believing compression socks alone will solve the problem. They won't. Compression socks are a supportive tool. But the real improvement usually happens when they're combined with daily movement, proper hydration, deep breathing, and the lymphatic routine I taught you today. The body needs consistent support, not isolated solutions. Right now you may be thinking something very reasonable. "Doctor, when will I start noticing improvement?" And I want to answer honestly. If you've been dealing with swollen ankles and legs for a long time, it would not be realistic to expect a dramatic transformation overnight. The body needs time to adapt and reorganize processes that may have been sluggish for months. But I also want to give you realistic hope. Most people who apply these habits consistently begin noticing small changes sooner than expected. First, they usually wake up with less tightness around the ankles. Then they notice their legs take longer to swell during the day. Later comes something many patients describe as a feeling of lightness. Walking becomes more comfortable. Shoes feel less tight. The skin no longer feels as stretched. And gradually the body begins responding better. I remember Elena, a 74-year-old patient who told me she avoided looking at her ankles every night because seeing them so swollen made her anxious. After several weeks of simple, consistent changes, she told me something deeply emotional. "Doctor, I'm no longer afraid every time I take off my shoes." And that made me reflect on something very important. Sometimes the problem is not only physical. It's emotional too. Because when the body changes and nobody explains what's happening, fear, uncertainty, and loss of control begin to grow. That's why I insist so much on education. When you understand what's happening inside your body, you make different decisions. You stop feeling helpless and begin participating actively in your own well-being. And that has enormous value. After so many years practicing medicine, I've learned that the human body maintains a remarkable ability to adapt even later in life. Sometimes we underestimate how much improvement can happen simply by restoring consistent daily habits. I'm not saying every problem can be solved with lifestyle changes. That would be irresponsible. Some illnesses absolutely require medication, specialized treatments, and medical follow-up. Of course they do. But there are also many age-related problems involving mobility, circulation, and quality of life that can improve tremendously once you understand how to support your body properly and consistently. And you deserve that information. Whether you're 60, 70, or 85 years old, your body is still responding, still adapting, still trying to rebalance itself every single day. What changes with age is not the possibility of improvement. What changes is that consistency becomes more important than intensity. So I want to suggest something very simple. Tomorrow morning, before getting out of bed, dedicate 5 minutes to your body. Elevate your legs. Take deep breaths. Move your ankles. Do the gentle upward massage. And repeat it every day for the next few weeks. Then come back and tell me in the comments how you feel. I truly enjoy reading your experiences because sometimes your story may help someone else who is silently going through the exact same thing. And if while watching this video you thought about your mother, father, spouse, sibling, or a friend struggling with swollen legs and worried about their health, share this video with them. Sometimes simple information arrives exactly when someone needs it most. I also want to warmly invite you to subscribe to the channel and turn on notifications. Every day we share new videos created especially to help adults over 60 better understand their health through clear, practical, and compassionate information. And if this video brought you comfort or clarity, leave me a comment. I love knowing where in the world you're watching from and hearing about your personal health journey. Before we finish, I want to tell you something very personal. Be grateful for your life. Be grateful that you can still listen, learn, and make decisions to care for your body. Even with limitations, pain, or challenges, having another opportunity to improve your habits is already an incredible gift. Never underestimate the value of continuing to learn how to care for yourself. And if you have faith, take a moment to thank God for walking beside you, for giving you strength, and for allowing you to gain knowledge that may help you live with greater peace, comfort, and well-being. Finally, remember something very important. This content is educational and informational only. It does not replace professional medical evaluation or personalized treatment. Every person's health situation is different, and it's always important to consult a qualified healthcare professional regarding persistent symptoms or specific concerns. And especially, seek immediate medical attention if swelling appears suddenly in only one leg or is accompanied by chest pain, shortness of breath, fever, or rapid worsening symptoms. Here on Dr. Gabriel Mena's channel, we are truly grateful to support you every day with practical information that helps improve habits, better understand the body, and live this stage of life with greater comfort and peace of mind. Tomorrow we'll have another new video created especially for you, and we'll be here waiting to continue learning together, step by step, how to care for your health in a practical, simple, and human way.